Hello everyone, welcome to Module 4, Part 4 of Digital Health Foundation course for nursing. In this part, we will be looking at how digital technologies like telemedicine and telenursing are transforming the healthcare industry. Again, introducing myself, I am Brigadier Dr. S. Geeta from the Military Nursing Service. Presently, the Brigade MNS at Headquarters, Southwest Command, Jaipur. While in service, as a part of in-service education, I graduated, I post-graduated and completed my doctorate in nursing and many other certification courses. As a Brig MNS of Headquarters Southwest Command, I currently oversee operations across 10 hospitals. I have rich academic and administrative experience because I have served in both clinical and administrative appointments. As you are aware, this module 4 has been divided into 5 parts. We have completed 3 parts till now, wherein part 1, we discussed about health information system. In part 2, we understood hospital management information system. And in part 3, we dealt with electronic medical record and enterprise resource planning solutions. In part 4, we will be exploring telemedicine and telenursing, covering its different types, key platforms like eSanjeevani, and the NIMHANS telenursing guidelines for nurses. We will also begin our journey into remote patient monitoring, that is RPM, with examples like tele-ICU by 10-bedded ICU. Let's dive deeper into each of these topics. Now let's look at telemedicine and telenursing. In this part, we will explore how technology enables patient care beyond the hospital walls. Before we dive into telemedicine, let's take a moment to reflect on this. With today's digital systems giving providers real-time access to patient data, does physical proximity still define quality care? Then, in that case, what kind of tools and technologies are enabling remote patient care today? Jot down your thoughts. We will soon connect them to how telemedicine and telenursing bridges the distance in modern healthcare. Introducing you to the topic of telemedicine. Telemedicine refers to the use of information and communication technologies to provide healthcare services remotely. This includes consultations, diagnosis, and treatment. Telemedicine Practice Guidelines 2020 in India offer a legal and ethical structure for a RMP or a registered medical practitioner to deliver care virtually through secure digital platforms. That means the person is offline. An important offshoot of this advancement is telenursing, which enables we nurses to support patient care remotely. We will explore on this. We shall take up a case scenario. Anita G is a 60-year-old woman who is experiencing recurring headaches. She connects with Dr. Rashid, a RMP or a registered medical practitioner, through an online video consultation. Now, in this case, multiple individuals may be involved. Anita ji, her caregiver, is her daughter. Dr. Rashid is the registered medical practitioner. Dr. Rashid consults Dr. Amit, who is a neurologist, for her problems of recurring headaches. And he also requires or takes help of Rita, the registered nurse or a healthcare worker. According to Telemedicine Practice Guidelines 2020, there are specific types of interactions permitted among such participants. Let us examine how these interactions are categorized and regulated. This slide shows how they are categorized and regulated. Anita ji books a video consult with Dr. Rashid to discuss her problem of recurring headache. That is, she is providing information as a patient and having an interaction with the doctor. Second, provider-provider interaction. Dr. Rashid collaborates with Dr. Amit, who is a neurologist, to evaluate Anita ji's MRI and decide on the next steps. The third step is provider caregiver. Anita ji's daughter updates Dr. Rashid about her mother's symptoms and progress during a follow-up teleconsultation. And the fourth one, nurse to provider interaction. Nurse Rita supports the consult by sharing vital signs and clinical observations with Dr. Rashid. These categories reflect how telemedicine facilitates communication across patients, caregivers, and multiple healthcare personnel. An example of telemedicine is eSanjeevani, which is a national telemedication service or NTS of India, which is hosted by Ministry of Health and Family Welfare and developed by CDAC Mohali. It is designed to ensure accessible healthcare across the country, particularly in remote and resource-limited areas like the primary healthcare centers. This platform of eSanjeevani covers two major services. That is eSanjeevani Ayushman Bharat Health and Wellness Center, that is doctor to doctor services. This connects the primary healthcare centers with the specialist doctors for remote consultation. The second service is eSanjeevani OPD, that is patient to doctor. This service provides outpatient care directly to patients in their own homes. As of 9th April 2024, eSanjeevani has served over 230 million patients, bridging the healthcare gap across the nation. Let us see a success story using eSanjeevani, a case study of overcoming oral cancer. We have Pradipta Kumar Patra, who is a resident of Orissa, who developed a non-healing ulcer which necessitated surgery. In routine screening of non-communicable diseases in patients, a community health officer, who is a nurse of that area, observed Pradipta's non-healing ulcer and high blood sugar levels. She, recognizing the urgency, the officer or the CHO used the eSanjeevani platform to consult a medical and surgical specialist. As a result, Pradipta received timely prescriptions and guidance for lifestyle changes because he had history of smoking and alcohol consumption, which led to oral cancer. His condition has been stabilized since then. It shows how digital tools like eSanjeevani can bridge healthcare gaps and save lives. This is the success story of Pradipta. Before we explore further, with virtual consultations becoming more common, how exactly do nurses help make telemedicine successful and accessible? Let's take a moment to reflect, jot down our thoughts, and know how nurses can contribute to the adoption and effectiveness of telemedicine. Having dealt with telemedicine, let's have an overview of what telenursing is. Telenursing is a newer concept which evolves aspect of telemedicine that specifically focuses on nursing care which is delivered remotely. Telenursing involves using telecommunication technologies to provide nursing care and services from a remote distance or from a far off place. It enables nurses to monitor, support, educate, and care for patients without being physically present. Please understand this, without being physically present. We are virtual patients. In a country like India, where nurses often serve as a primary healthcare, in a country like India, where nurses often serve the primary healthcare contact in the rural areas, this telenursing becomes particularly crucial. This strengthens the connection between patients and healthcare services, with nurses playing a central role as liaisons in ensuring continuity of patient care. Telenursing is a process. When I say it is a process, it is step-by-step method and it has 6 steps. For delivering remote patient care through telenursing, the first step is patient scheduling. Nurses should begin by helping patients book appointments using a phone call, SMS, or telehealth platform. This ensures timely access to care. The second step is communication platform. The nurses assist patients in logging into or accessing the telemedicine platform. This may include formal systems or informal tools like Zoom or WhatsApp. The third step is virtual consultation. During the consult, nurses should help gather patient history or vitals, clarify any doubts, post-consultation, ensuring that instructions are clearly understood. The fourth step in the telenursing process is clinical documentation. The nurses document the visit details in the patient's electronic medical record or health records, maintaining accurate and updated records for continuity of care. The fifth step in the telenursing process is prescriptions and referrals. Once the doctor gives instructions, nurses communicate the prescription to the patient and help coordinate referrals if needed. The last and the final step of the telenursing process is follow-up and monitoring. Nurses conduct follow-up calls or messages to check on system progression, medication adherences, and overall well-being, completing the cycle of care. These are the 6 steps of the telenursing process, and every step is mandatory. What do you then think is the role of a nurse in telenursing? The first one is patient identification and consent. The nurse identifies the patient and secures explicit consent. Mind you, we have to take consent even for telenursing, which is essential for both ethical and legal compliance. To safeguard we nurses, we have to take consent at the time of teleconsultation. The second step or the second role of a nurse is initial assessment by registered nurses. We then perform a preliminary assessment by collecting vital signs and the chief complaints and check for any red flag symptoms using standardized protocols. The third role is consultation pathway. 1. If it is an emergency, the nurse initiates the first aid and then refers the patient to the nearest facility. If it is a non-emergency, case, then the nurse proceeds to arrange for teleconsultation. The fourth role is teleconsultation with the registered medical practitioner. The nurse then shares the patient's data over a secure audio or video call with the registered medical practitioner. The doctor then verifies, identifies, and gives consent before prescribing the treatment. The fifth step or the fifth role is patient management. Based on the registered medical practitioner's instruction, the nurse then provides clinical care. This may include administering medications, performing wound care, or offering counseling and education. All, mind you, all this is being done remotely. The last step is documentation. The nurse then records the entire interaction with the patient and the care provided into the patient's health record or the electronic medical records and ensures continuity and accountability. This is the role of a nurse, or these are the 6 important roles of nurses in telenursing. What do you then think are the benefits of telenursing to nurses? Telenursing allows nurses to deliver care to patients in rural or remote areas, or those who may not be able to travel due to age, illness, or disability. The second benefit is greater scheduling flexibility. With virtual platforms, nurses can better coordinate and manage appointments more efficiently, offering timely support while reducing the need for physical queues or wait times. The third benefit is expanded roles in care delivery. This telenursing empowers nurses to take on more advanced responsibilities, such as coordinating care, conducting triage, educating patients, and even monitoring vitals and symptoms remotely. The next benefit is by minimizing the need for frequent in-person visits, telenursing enables nurses to allocate more time to high acuity patients, ultimately helping to ease workforce strain, especially in resource limited settings, and reduce workload of nurses. Hence, this model not only benefits patients but also enhances operational efficiency in healthcare settings. These are the 4 benefits of telenursing. Through telenursing, we nurses can deliver care remotely. Then, when we are delivering remote nursing care, what rules and safeguards must be followed by us to ensure that we are doing ethical and safe nursing practice? In that case, what are the key guidelines nurses need to follow while delivering telenursing services? Think about it, jot down the points, and then we will go into the next. Yes, friends, we have Telenursing Practice Guidelines 2020, which is developed by NIMHANS Bangalore. This Telenursing Practice Guidelines 2020 provides a structured framework so that we nurses and midwives deliver ethical, effective care through telehealth platforms. These guidelines apply to registered nurses and registered auxiliary nurse midwives under the Indian Nursing Council Act of 1947. They help us ensure professionalism, patient safety, legal compliance, and adherence to quality standards while using digital tools in nursing practice. NIMHANS Telenursing Practice Guidelines 2020 has three processes, or this telenursing processes has three steps as per Telenursing Practice Guidelines 2020 developed by NIMHANS. The first step is before consultation. First, the nurse must assess whether telenursing is appropriate or in-person care would be more suitable. Once that is confirmed, the next step is to verify the identity of both the nurse and the patient. This includes collecting the patient's name, age, and the valid ID of the individual. It is also essential to obtain the patient's consent for the consultations, which can be written, verbal, or digitalized. Additionally, children must always be accompanied by an adult during teleconsultation. Very important. Children must always be accompanied by an adult during teleconsultation. The second step of the telenursing process is during consultation. During consultation, the nurse begins by collecting essential patient information. This includes recording the vitals, noting down the symptoms and signs, and gathering relevant medical history. The nurse then should share these findings with a registered medical practitioner to support diagnosis or referral decisions. As needed, the nurse must also carry out clinical care tasks such as monitoring the patient's condition, managing wounds, or administering medication based on the registered medical practitioner's guidance. This is the second step of the telenursing process during consultation. The third step is patient support and documentation. This is the final stage of the telenursing process as per NIMHANS guidelines. We nurses should provide patient support and ensure accurate documentation. This includes educating patients on medication adherence, lifestyle modifications, and necessary follow-up actions. Nurses must also maintain the records precisely, uphold data privacy and ethical standards, and operate strictly within the professional scope. It's crucial to avoid any misuse of patient information or overstepping clinical responsibilities. In short, the three steps of the Telenursing Practice Guidelines 2020 as per NIMHANS are: first one, before consultation; second one, during consultation; and lastly, patient support and documentation. These are the three steps of telenursing process as per NIMHANS practice guidelines. The essential tools include devices like smartphones, tablets, or laptops, and high-speed internet connection. Very important, because we need to secure apps for communication such as WhatsApp, Skype, or government recommended platforms, and an high resolution webcam positioned at eye level for clear interaction. The infrastructure requirements are a quiet room with good lighting, minimal noise, light colored walls to improve video clarity. These all helps us focus on creating a conducive environment. And the third one, that is the communication mode, which includes video, which is preferred method for clinical assessment because they can at least see face to face, and an audio or text, which may be used if video is not feasible. But we need to strictly adhere to the prescribed protocols. With this, I think you must have understood what telenursing is and how do we practice telenursing process using NIMHANS Telenursing Practice Guidelines 2020. Now, let's check how much you have understood about what telenursing is.
Greetings to all of you. So far, you have been hearing in Module 4 various aspects of the digital health in nursing. Going forward today, we will be exploring on remote patient monitoring, that is RPM. I am Lieutenant Colonel Mrs. Manonmani Venkat, completed my BSc Nursing from College of Nursing AFMC, Pune. My post-graduation in obstetric and gynecologic nursing from LT College of Nursing, SNDT University, Mumbai. I have also done my diploma in orthopedic nursing from the Armed Forces Medical Services Board. I have been a nurse educator and an administrator with 45 years of experience, including 28 years of teaching. I served in the military nursing services for 22 years, and equal number of years I've served in the civil colleges of nursing as vice principal and principal. And I could proudly say that I'm the founder principal of Sadhu Vaswani College of Nursing, Pune. I have participated in the various committee activities of the university, that is the curriculum committee, the academic councils, the EGBG Board of Studies. I've been a paper setter, examiner, and I've been in various other committees such as research committee. I've also served as an INC ad hoc inspector, NAC peer team member, currently serving as the advisor of the Society of Midwives India, with whom I am connected since its inception and have held various posts in this past 25 years. As a part of the SOMI activities, I have been involved in conducting conferences, participated in national advocacies and midwifery initiatives in the country. Let's look at how remote patient monitoring enables continuous care by using technology to track patients' health from a distance. In telemedicine, care travels across distances through voice or video. But what if critical health data like blood pressure, oxygen levels, or glucose readings could travel across distances in real time? Take a moment to jot down your thoughts. This reflection will help frame the possibilities of remote patient monitoring and its impact on patient care. Remote patient monitoring, or RPM, enables healthcare providers to track patient health remotely using digital health devices. Patients use tools such as blood pressure monitors, glucose monitors, and wearable sensors to measure vital signs. These readings are shared electronically with healthcare providers. RPM supports real-time tracking, analysis, and reporting, allowing for timely clinical decisions without requiring the patient to visit a healthcare facility. Common RPM devices are blood pressure monitors, continuous glucose monitors, heart rate monitors, ECG machines, pulse oximeters, and smart weight scales. These tools help maintain continuity of care, especially for patients with chronic conditions or those in remote areas. Nurses
So,
play a crucial role in enabling remote patient monitoring by using digital tools to assess a patient's condition without being physically present. Their responsibilities typically include collecting data, review health data from wearable devices or home monitoring equipments, that is BP, glucose and oxygen, etc., and share with health providers in real time. Assessing the patient's status, interpreting the collected data to evaluate whether the patient's health is stable. This includes identifying trends that may indicate early warning signs or deterioration, providing education and support, guiding patients in managing their health remotely by explaining medication schedules, offering lifestyle advices, and answering any follow up questions they may have. Nurses also play an integral part in ongoing patient support during remote monitoring. Their responsibilities further include responding to alerts by contacting the patient, informing the provider, or adjusting the care plan, coordinating care, serve as the link between patients and the care team, address concerns, clarify instructions, and support virtual check-ins or telemedicine visits. Documenting and reporting. They ensure accurate records are maintained regarding patient progress and interventions, and these updates are shared with the clinical team to ensure continuity and informed decision making. RPM users for nurses. Remote patient monitors applicable across wide range of clinical scenarios where nurses play a vital role. Let's walk through some common areas. Primary care. Nurses support routine care, initial consultations and follow-ups, offering virtual check-ins and counseling. Chronic disease management. For conditions like diabetes, hypertension, and asthma, nurses monitor vitals, adjust medications under guidance, and offer lifestyle counseling remotely. Post-surgical care. Nurses follow up with patients recovering from surgery, track their progress, and guide caregivers in using RPM tools to report vitals. Elderly and homebound patients. Nurses monitor seniors remotely, ensuring medication adherence and early identification of health issues, especially in rural or mobility limited setting. This especially I have witnessed in the home settings where the son had in his mobile app and he was monitoring his father's activities who was having elderly problem, the geriatric problems, and he would attend to immediately as they were saying side by side. The next one, COVID-19 home isolation monitoring. Nurses track symptoms and vitals, providing emotional support and escalate care when necessary. Maternal and child health. RPM enables nurses to track high-risk pregnancies, fetal vitals, and provides timely interventions or counseling. Palliative or end-of-life care. Nurses support and comfort care, coordinate with doctors, and maintain family communication is sensitive end-of-life scenarios. Mental health monitoring. Nurses assist with remote support for patients with depression or anxiety by conducting check-ins, monitoring well-being, and escalating critical changes. Rehabilitation and physiotherapy. Nurses help patients follow exercise regimens, monitor improvement using wearable techniques, and keep them motivated throughout recovery. Remote patient monitoring offers a wide range of benefits that enhance both patient care and healthcare system efficiency. Chronic disease management. RPM supports continuous tracking of vital signs such as blood sugar and heart rate, aiding in the management of long-term conditions like diabetes, cardiovascular disease, and asthma. Reduced hospitalization and emergency room visits. By detecting changes early, RPM helps in addressing issues before they become emergencies, ultimately reducing the need for hospital admissions and emergency room visits. Post hospitalization care and early discharge. RPM enables safer, earlier discharges by supporting ongoing recovery monitoring at home, reducing the length of hospital stays. Healthcare coverage. It extends healthcare reach to underserved or remote areas, addressing challenges of limited access to healthcare infrastructure. Reduce risk for patients and workers. By limiting in person interactions, RPM minimizes contact, thereby lowering the risk of transmitting infectious diseases. Preventive management. RPM empowers patients with timely data, enabling better self care and early interventions to prevent complications. Each of these benefits contributes to a more responsive, efficient, and patient centered approach to healthcare delivery. Let's look at a case study that illustrates how remote patient monitoring is transforming critical care delivery in rural India. The 10-bed ICU, tele-ICU initiative was introduced to address the lack of access to quality intensive care services, particularly in remote areas. This initiative leverages tele-ICU technology to allow doctors and specialists to monitor and manage patients remotely through mobile devices or laptops. Using a hub and spoke model, it enables real-time specialist consultations, access to patient records, and continuous monitoring through a 5-parameter data stream. By facilitating video communication and centralized expert oversight, this model helps to overcome workforce shortages and ensures that even patients in distant locations receive timely and expert critical care. Let's take a quick pause and check your understanding. Nurse Anna has a patient with chronic heart disease living in a remote village. How can she assess the patient? A. Use remote patient monitoring to track vital stats and symptoms. B. If physical presence is necessary, remote monitoring won't help. C. Ask the patient to visit once a month. D. Ignore the patient's location. It doesn't matter. That brings us to the end of Module 4, Part 4. In this section, we explored how nurses engage with digital health through telemedicine, telenursing, and remote patient monitoring. That is RPM. In Part 5, we will explore personal health apps, devices, their users in self-monitoring, health track, patient engagement, and how nurses support their integration into care routines. Thank you for completing Part 4. We hope this session gave you valuable insights into how digital tools are reshaping remote healthcare delivery. Now join Part 5, which is the final part of this module, to explore the exciting world of personal health apps and devices and their role in patient care.